Our presentation is on Becker's Muscular Dystrophy, which is BMD. It is also known as these other names. The disorder is mainly known for the degenerative effect on the muscles of the body. It occurs 3 to 6 times out of every 100,000 births, which affects mostly males. This disease is due to a mutation of a recessive gene on the X chromosome. The mutation causes the body to produce only partially functioning dystrophin proteins, causing the muscle cells to be fragile and easily damaged. These proteins protect the body from degeneration, but with the mutation of the proteins, the degeneration will definitely occur, but not as quickly or as completely as the other forms of muscular dystrophy. Symptoms typically appear between the ages of 6 and 18. Patients will present with toe walking, difficulty ambulating or standing, and eventual heel cord contractures, which needs to be fixed with surgery. Progressive symmetric muscle weakness occurs and naturally affects the patient's balance and coordination overall. Respiration difficulty and heart conditions such as cardiomyopathy will also occur. The breathing difficulty can eventually become so bad that the patient has to be placed on a ventilator. A BMD patient will also have pseudohypertrophy. This means abnormally enlarged calves. Despite the swollen calves causing the facade of having stronger calves, they actually have very weak muscles. In adult years, the patients will also have to depend on a wheelchair and this also enhances the problems such as muscle contractures. At the current moment, there is no cure for BMD. There are medications and steroids that can be used to reduce symptoms and maximize quality of life. Some patients have to take ACE inhibitors and beta blockers if they present with a heart condition. OTs, PTs, and orthopedics work together to have the patient perform full range of motion exercises to keep the patient from becoming bedridden and staying active. They may also do respiration therapy to help break up the mucus in their lungs and assist with coughing. Later in life, a BMD patient most likely will become reliant on wheelchairs and assistive devices such as lower leg braces to prevent contractures and stay mobile. The assistive devices help maintain function, while the therapies help strengthen muscles and movement. They might also need a heart transplant if the cardiac muscles become too weak to properly circulate their blood.
Our client is MD, and he's a middle-aged man who was diagnosed with Becker's muscular dystrophy at 13 years of age through a muscle biopsy of his calf. He started his blog called Life with Muscular Dystrophy in 2011. He says the blog was his way to share the good things he's learned through his experiences with the disease, since as a kid he was unable to find any literature that was uplifting. For medical history, MD has undergone bilateral heel cord lengthening, which is a common procedure. He has also experienced coexisting condition of anxiety. He's blogged about this anxiety and believes most of it stems from his diagnosis and disability and prefers not to seek medication to treat it. He instead uses his worries and fears to push him to achieve more. MD has graduated top of his class in high school with a 4.0 and went on to get a bachelor's in civil engineering from Stanford. He has always prided himself on his educational accomplishments. For a career, MD started his own Hawaii web development company in 2000, which led him to move there and live there independently. MD is also a published author. For hobbies, MD has played cello since the age of 5 and continues to play today. He also plays various wheelchair sports, such as a professional wheelchair tennis team. MD has traveled around the world despite his disability. He's gone to London, New Zealand, and Africa, all while in his powered wheelchair. He has also road-tripped across the U.S. for his professional tennis games and just for fun.
So MD had lots of occupations that were talked about earlier as well, and those include traveling. He works a lot. He loves to write books and both on his blog as well. He's a website developer for his profession, and he's been playing cello for many years. He also participates in tennis and swimming for wheelchair users, loves to stay in contact with friends and family, and is also participates in ADLs and IADLs like showering, dressing, driving as well. And the occupation we chose to focus on for improvement is showering. So some of the client factors that affect this occupation are his limited strength and muscle power, specifically in his right upper extremity, his abnormal muscle tone, his fatigue, and also As a person, he values independence and has a lack of motivation, specifically for showering. Because his performance is affected by these client factors, there's low efficiency, the task does take longer, he does currently get frustrated and avoids the task as well, although he does use some adaptive equipment. Overall, these performance effects, the client factors influence the ability to thoroughly clean himself in the shower. And in the same way, he's spending a lot of time and energy on this task, which actually has inefficient patterns. And because of his lack of motivation, he's not as encouraged to find more adaptive equipment or assistive technology to help him with this task. And overall, this discourages him and contributes to his low shower routine consistency. So that's what he would need to work on in therapy.
The primary theory of EHP is that therapy is most effective when it is embedded in real life. Without this, the client may resist the therapeutic changes in behavior that therapy is attempting to achieve. This, said in a different way, is that it is difficult to develop a therapy that a client is excited about and ready to take on, without considering the ways that they enjoy doing them now, as well as the way that therapy may affect their life. EHP hopes to form a connection between the person and their environment in order to make occupations more accessible to the individual. In order to consider how context is important to the individual's experience and occupation, EHP has broken context down into 4 categories: temporal, physical, social, and cultural aspects of the environment. Temporal is the age maturity level of the person, the phase in life which they are in, health status, and the amount of time the task takes and needs. Physical is the non-human elements of the context. Social is the establishment of norms and important persons in relation to the activity. Cultural encompasses the customs, beliefs, and activity patterns, behavior standards, and expectations of the society. The treatment categories of EHP include established to restore, which is returning a person to their original ability; adapting and modifying, which is changing the actual context in which a person does the task; altering to match the client to their current ability; prevention, which is predicting future occurrences that can make participation difficult and actively attempt to avert them; and creating, which is to create an environment that makes the task possible. When working with MD, it is important to take into consideration the context within which he lives. He has found and created many ways that have allowed him to continually live independent and function in all the aspects of his life. The occupation that we chose was showering. MD informed us that when he was younger, he loved the relaxation and warmth he got from a shower, and would take one every single morning. However, as time went on, it became more difficult. MD is now living in a rented apartment that uses a bathtub shower combination. This made things more difficult for him because he now has to climb into the tub. He was able to add grab bars and industrial strength shower curtain that was bolted into the wall. Although minuscule, the addition helped tremendously. Taking into consideration MD's ability, taking into consideration his ability, the first step is to get MD motivated. So we offered for him to make more social events to encourage him to go out more often, and obviously he would need to shower. Another factor that we incorporated was to remind MD of the feeling that he got by self-motivating him. The next step would be to make the task easier. MD mentioned that he wanted a carved out tub, but since he's renting, he was unable to do so. Instead, we will find a transfer chair that MD can slide onto outside of the tub, swing his legs over, and then scoot in. Also, we will add a handheld shower head that he can prop onto the side of the wall in order to make it reachable at all times.
Occupational therapists play a critical role in treatment of BMD because activity is essential throughout the entire disease course. The medical team must work together because serious issues, including contractures, cardiac problems, and respiratory muscle weakening, often accompany BMD. In summary, there are many courses that we take at school that are directly applicable to working with people with BMD. These include, but are not limited to, assistive technology, functional anatomy, occupation across lifespan, and neuroscience, neuroanatomy, and neurorehabilitation. As occupational therapists, it will be our job to see beyond the disability or illness in order to treat each person individually and holistically. MD is just one example of all that people are capable of achieving despite the challenging situations they may be facing. And here are references that we use throughout the presentation. Thank you.